Well, the answer to what is a kidney stone, bizarrely, is a kidney stone is a stone. They are little rocks. They're like the thing you dig out in the garden. Some of the stones are a little bit different. Some of them are more like chalk or even cheesy material. A lot of them kind of have kind of bits of kind of protein and thing like that. So they can be quite soft, but most of them are just like rocks from your garden. Essentially, 1 in 10 men will suffer a kidney stone in their life. Once you've had a kidney stone, you've got about a 50% chance of another one. So doing something about it is sensible. Traditionally, women have had a 1 in 20 risk of kidney stones. Commoner thing in your teens because of infections, and also after the menopause when the female hormones drop, the rate of kidney stones goes up again because female hormones tend to be protective. But at the same time, we're watching that 1 in 20 go down and down and down, and it's now approaching the 1 in 10 that we see in men. And it's probably related to the diet, increasing your salt, increasing your animal protein. The kind of more Western diet is affecting women's ability to produce stones. By far, most stones we see are caused by people probably not having enough fluid. Now, everyone is probably sitting in a state where their urine is really trying to make kidney stones all the time, but that's held in check. Some people are missing the things which keep your urine in check, and then when the system's stressed, so you go to the gym, you have a big session there, you forget to fill up on fluid afterwards, you get dehydrated, crystals can form, and the moment that happens, suddenly other bits can glue on and you end up with a little stone. We anecdotally see quite a lot of stones a couple of weeks after Ramadan finishes, when that's in the summer, and also after hot weather, which can cause a lot of symptoms. The symptoms can be varied. Everyone remembers the first person they saw with a kidney stone. They are fantastically painful, allegedly more painful than childbirth, according to the ladies who have both. But that's not the only symptom they can present with. Some kidney stones present with blood in the urine, so that can be a cause of that, and often blood in the urine is something which frightens people immensely, but it tells you it's worth getting it checked out if you ever see blood. Also, people can present with infections. People can just turn up with lots of infections in the urine. Now that's something more common in ladies than men, but some men do get it. And a quick ultrasound scan can sometimes look at that. But another one is nothing at all, essentially. Some people have no symptoms. Maybe the kidney's got blocked over time and a stone's formed behind it. And that's picked up usually incidentally. So you have an ultrasound scan or an X-ray for another reason and something's seen on it, and then it gets sent to us. There are lots of different treatment options available to people. Often, little stones can be treated with decent painkillers and a tablet which helps the stone fall out. And the vast majority of stones we can treat that way. Other stones need some treatment, so if it's not coming out, or it's in a position we know the stone won't come out, we've got 3 main options available to us. One of the ways is via sound waves from outside the body, so no cuts are made, there's no intrusion, if you like, into your person. And that's quite good at breaking stones up, especially in the top of the kidney tube and parts of the kidney. We're also able to break up stones using both straight telescopes and bendy telescopes that will go around corners, and we can use a small laser fibre to break these stones up safely and take them out. For the bigger stones in the kidney, we do those via a little hole in the side, a bit of a kind of a keyhole operation, but a very successful one. So we put in something the size, if you like, of a pen, and we can take stones out that way. It's the proportions which are changing. The issue at the moment is the number of women presenting with them. Women were always protected by their female hormones from making kidney stones. We had a little peak in the teens, which were infection related, and then another peak after the menopause, after the female hormone levels dropped. But we're now getting many more female patients coming ratio is moving towards almost equality. Generally, people take better care of themselves, and so are, for a lot of people, so there's a move away from kind of a global kidney stone problem and more towards specific groups, but we still see a lot of travellers, a lot of students, a lot of businessmen and salesmen who maybe don't get a chance to keep their fluid up. To reduce your dietary risk of kidney stones, all the studies looking at this have realistically found the most important thing is drinking enough liquid, especially water. You can flavour your water if you want, that's absolutely fine, but it's down to volume. Your risk goes significantly down if you can drink enough to produce 2 litres of urine a day. Your urine needs to come out looking like lemonade rather than Lucozade. And that vastly reduces your risk over the other factors. But we've also found that for your standard stone forming patient, reducing your need of salt, if you have a lot of animal protein, reducing that as well is helpful. Avoiding foods containing lots of oxalate can help, and there are especially things like rhubarb and spinach and beetroot can be helpful too. The funny thing is that most people want to cut down on calcium in their diet because they think that's a problem, but actually calcium tends to be protective. So a normal calcium diet, normal levels of yogurt and things like that are fine. In the end, a vegetarian diet with lots of fluid would be best, but most of us enjoy a bit of meat, so keeping a balance is the key.